Hantavirus. This is the introduction to hantavirus. During the 1950s, a group of United Nations soldiers in the Korean War got randomly sick. Around 3,000 troops and no explanation for their illness. Of the soldiers who were sick, nearly 15% of them lost their lives. This was the first time hantavirus was discovered, but nobody knew it yet. Nobody knew exactly what it was until more than 20 years later when they were first able to isolate the virus. Scientists were able to find the virus in a striped field mouse near the Hantan River in South Korea, leading to the name hantavirus. Hantavirus is a zoonotic disease, which means each individual strain has a specific host, spreading mainly through rodents. The hantavirus is distributed in all continents of the world except Antarctica because the habitat is too cold for rodents to live in. There's two specific types of hantavirus. There's Old World and New World. Old World hantavirus is found in countries outside of the United States, mainly like Europe and Asia. Commonly found strains to the date include like Hantan, Sial, and Dobrava hantaviruses. Old World hantaviruses cause HFRS, which is hemorrhagic fever and renal syndrome, primarily affecting the kidney. These types of viruses only last for a few days after they resolve, and then they'll end up resolving themselves. The New World hantaviruses are found in the United States, and commonly found strains include the SNV and Andes hantavirus. These viruses can cause HBS, which is hantavirus pulmonary syndrome. This syndrome has a 38% mortality rate, and it primarily affects the lungs. Rodents that carry hantavirus in the United States are white-footed mouse, the cotton rat, deer mouse, striped field mouse, and rice rat. It is very hard to diagnose this virus because it is mistaken as influenza in the first couple of days. And some people also with the infection don't always show symptoms. And others, there's vague symptoms such as like high fever, muscle aches, headaches, and nausea, and they begin very suddenly. People with mild symptoms recover completely. Otherwise, there's more serious cases, which may lead to death.
All right, so the transmission of hantaviruses. Hantavirus's host reservoir consists mainly of rodents, specifically mice and rats. Humans can contract the virus after being in contact with an infected rodent. Transmission methods include being bitten by a deer mouse or a cotton mouse or a rice mouse, and that has been infected with the virus. Consuming food that has been contaminated by the rodents, even breathing the air that has been contaminated by the virus, or in a room where you're breathing air that has infected rat droppings, touching surfaces that infected rodents have contaminated, and then touching your eyes or your face. Human transmission is extremely rare, but there have been a few cases of it in the 2017 outbreak, but it's not a main form of transmission for this virus. The virus is transmitted to humans once the virus has entered the body through inhalation, touching your eyes, breathing into your mouth or your nose, or direct transmission with the surface. And then the ecology of this virus. Hantavirus typically have one primary host. In the case of the HBS outbreak, the hantavirus pulmonary syndrome outbreak in 2017, that host was a deer mouse. These rodents can live anywhere in the world, typically in rural areas and houses, barns, and farms. Hantavirus infection rates and the general spread of the disease directly correlate to the mice population in that affected area. Conditions in the world that would favor an increase in mice population would be places with mild winters and lots of summer rain. The virus is spread horizontally among the mouse population through biting and fighting. And the virus can infect humans through direct contact with the rodents in homes or structures that are sheltering the mice.
So specifically for exposure to humans, transmission can occur anywhere where an infected rodent comes into contact with a human. So anything like their saliva, droppings, urine, or any other nesting material. You're more likely to get infected in rural areas, including forests, farms, and fields. And then it's an airborne transmission, so the virus-containing particles are mixed up into the air and inhaled by the humans. Some individuals who are more likely to be exposed are construction workers, pest services, people who remodel abandoned buildings and go into the crawl spaces, and then hikers and campers also can get it more often. And then other ways for human exposure, if an infected rodent bites a human, but this is pretty rare because usually they scurry off. And if an individual touches something that was contaminated by the virus, or eat contaminated items that have touched or been even near the rodent's droppings, urine, or other nesting material.
So there are various pieces of epidemic potential for this virus. So listed on the slide is the first United States outbreak. This outbreak occurred in May of 1993 in a geographic location shared by Arizona, New Mexico, Colorado, and Utah, which is more commonly known as the Four Corners. During this time when the outbreak occurred, many scientists discovered that the El Nino weather event the year before had caused the hantavirus to evolve. The weather brought higher than average rainfall in the Four Corners, which allowed for more plants, resulting in an increase of the rodent population, also known as the main reservoir for hantavirus. In addition to the 1993 outbreak, there were also two others in the United States. These more recently, with one in 2012 at Yosemite National Park, and the third with infected cases throughout 11 different states, which again happened to occur in more foresty states. The graph shows no true pattern, which makes this virus even more frightening and unpredictable. Based on research, the hantavirus conclusively depends on more atmospheric and climate elements, which can be challenging to track. To date, there are 728 total United States cases, with 63% being men, 37% female, and the mean age of 38 years old, but anyone between the ages of 5 to 84 can contract it as well. Listed are four major factors that can result in an epidemic. The one I specifically wanted to highlight was the weather and climate change factor, which is a main concern with the development of the hantavirus in the United States. It can happen unexpectedly, and anyone is equally at chance of contracting the virus, so necessary precautions should be taken seriously.
The sole manner to prevent the spread of hantavirus is to minimize exposure to rodents. This can be done by rodent control at home, the workplace, or campsites, food and waste hygiene practices, disinfecting possible areas of contamination or places of rodent contact with disinfectants, alcohol, bleach, or detergent solutions, and also by allowing aeration of enclosed infested areas before re-entering them. The response to hantavirus, there's no specific cure, vaccine, or treatment for exposure, and diagnosis can be difficult due to the immune response mimicking the flu. But if exposed individuals are often brought to the ICU for oxygen supplementation. Also, heavily infested areas should be brought to the attention of appropriate state or federal officials. The effectiveness of this, the earlier a patient can reach medical care, the increased likelihood of survival. Oftentimes experienced rurally, medical care can be scarce. However, there is still a 60% effectiveness rate based on mortality rate.
And here are some characteristics of hantavirus that can make it possible to be the next pandemic. Rodents that carry the virus are found all over the planet. Humans who are healthy can be seriously affected by the virus. They don't need pre-existing conditions to be fatally harmed by this. Climate change is better than conditions for rodents. Climate change is bettering the conditions for rodents to live, increasing their population, which increases the spread of the virus. The virus is capable of airborne transmission. If a human is in a room that has viral rat droppings, then they can contract it without needing to touch it.